Workers are quitting their jobs in record numbers, part of what is now called the Great Resignation. Around 4 million workers have quit their job each month between July and November 2021. American workers who are becoming their own bosses may be gaining new financial freedom, but they're losing a big advantage: health insurance benefits. Over 54% of Americans had insurance through their employer in 2020.
One of the reasons that I almost never considered leaving a staff position until recently was because of health insurance.
The Great Resignation might be even greater if it weren't for the way our health insurance system is constituted.
1 in 3 insured workers would consider leaving jobs if health insurance weren't a factor.
The system isn't easy to navigate. It's really difficult to figure out how much insurance is going to be, even as a self-employed person.
Many Americans turn to the Obamacare Marketplace to find an insurance plan. The Biden administration announced that signups hit an all-time high in December 2021.
There are significant limitations in marketplace plan coverage that A, you can't easily see, and B, that make the coverage meaningfully different from what you may have been, used to from your jobs.
I don't think there is a more important or complicated decision to make than picking a health insurance plan.
So can Obamacare work for this influx of uninsured Americans? And what's the lasting impact of the Great Resignation on healthcare coverage? The Affordable Care Act, frequently referred to as Obamacare, established the health insurance marketplace where people can find medical insurance plans from private providers that are not tied to their jobs. Erica Leman left her job in higher education to work on her wedding photography business full-time. She looked for a new insurance plan on the marketplace.
There were so many options, and all of them seemed just kind of like a lot of money for not a lot of support.
Since marketplace plans are offered by private companies, there's no limit to the number of people who can get their insurance through the marketplace. That means people participating in the Great Resignation won't be shut out. Increased participation in the marketplace may even encourage insurers to adjust their offerings. In fact, the number of insurers participating in the marketplace increased in 2022.
Individual health insurance plans are extraordinarily expensive. You need to be in a group in order to have really the benefits of a group insurance. If you're not in a group, you're going to have very high co-payments and deductibles and high insurance costs.
71% of uninsured Americans who decided not to get insurance from either a private insurer or through the marketplace said they didn't end up buying a plan because it was too expensive, according to a 2020 survey by the Commonwealth Fund. Nicole D'Onofrio left her staff position as a digital marketing consultant to start her own business. She also turned to the exchanges to find an insurance plan.
My previous job covered all benefits for an individual. So I never factored in health insurance into any type of expenses that I had. I didn't even realize were such great benefits until I left.
If you're trying to find a plan that is the same or virtually the same as what you had at work, you might not be able to do that. Marketplace plans, they have much higher deductibles. On average, most of them have much narrower provider networks. So if you have, a condition, you're pregnant, there's a doctor you're going to see now, there's a decent chance that that doctor will not be in all or even any of the networks of the plans that you look at. And you're going to have to go through and look at each network.
Health insurance is a big perk of working for a company, and workers know it. 26% of Americans would be very or somewhat likely to start their own business if health insurance wasn't a factor.
Even if you were a ruthless capitalist who is totally opposed to socialized medicine, you would have reasons to be concerned about the way we're doing things. If health insurance is holding people back from the perfect job or from starting their own business, potentially that is an invisible brake on the productivity of our economy.
Politicians want to be elected and reelected, so they're going to listen, I hope.
The government does offer subsidies in the form of a tax credit that help qualified Americans pay for a marketplace plan.
The vast majority of people who get coverage through the marketplace qualify for subsidies, for premium tax credits that will reduce the amount you pay each month. So the premiums are pretty affordable for most people.
The rules of whether someone qualifies can be difficult to follow. The requirements are based on age as well as income and vary by location. Additionally, people who have options to get their insurance through another source, such as an employer or through a spouse, usually do not qualify for any subsidies.
Only 30% of people are aware that you can get financial aid to buy one of these Obamacare plans.
I've been doing this for years, and I still trip over new stuff because the plans change every year.
Since there are many different plans with a range of costs and benefits on the marketplace, the government bases the subsidies on the price of what is called a benchmark plan, which is considered a mid-level plan cost-wise. The subsidies are determined on a sliding scale. People making under a certain amount only have to pay a percentage of their income. As a household's income rises, the percentage of the required contribution rises with it.
If you have very low income, the percentage you have to pay is zero. So the premium tax credit will cover the whole thing.
The pandemic may be partly responsible for altering the workforce dynamic. COVID has also spurred legislation to make insurance plans more affordable for most Americans, which means it may be the perfect time for folks to consider taking the leap.
The American Rescue Plan that Congress passed at the beginning of 2021 enhanced the marketplace subsidies, made them better for everybody, and made them available no matter what your income is.
Prior to the American Rescue Plan Act, an individual could only qualify for a tax credit if they made less than 400% of the federal poverty level, which comes out to about $51,000 for an unmarried person with no dependents. But if that same person made $52,000, they would pay the full price premium. The sharp line for qualifying is frequently called the Subsidy Cliff. The Subsidy Cliff impacts older Americans the most, especially in the middle income bracket. The American Rescue Plan Act removed that cap, making it so people who make more than 4 times the poverty level qualify for the sliding scale subsidy, basically making the subsidy cliff disappear. The legislation also changed the max a person would have to pay from about 10% of their income to 8.5%. It's rare for people who make above 600% of the poverty level, which is around $77,000 for an individual, to qualify for a subsidy. KFF estimates that the American Rescue Plan Act increased the number of people eligible for subsidized coverage from 18.1 million to 21.8 million people. But the subsidy enhancements are set to expire at the end of 2022. The Build Back Better Act includes provisions aimed to expand those subsidies. The Congressional Budget Office estimates that 3.4 million Americans would get coverage through the marketplace over the next decade if the enhanced subsidies are kept in place. The Build Back Better Act has yet to pass the Senate as of January 2022, which means these deals may not last.
If you find the perfect plan this year, you're going to have to do this whole thing again at open enrollment and see if your same plan is offered next year or if it's been changed. That's allowed. Insurers can make changes to their networks and to their formularies and to their premiums and their deductibles every year. So you are going to have to kind of stay on top of this.
The Obamacare Exchanges seem to be most people's simplest option when it comes to finding a comprehensive plan, but there are other options for entrepreneurs to explore. A temporary solution for many workers is a program called COBRA, which gives anyone who worked at a company with at least 20 employees the right to continue to pay for their insurance plan after they leave. Workers are usually eligible to stay on COBRA for up to 18 months. This option, however, is expensive because the previous employer is no longer subsidizing the insurance costs.
COBRA was definitely something I wish I could have just stayed with because I loved my previous insurance. I was used to all my providers. I knew it was a network. It was just like very expensive. It was like over 3 times the amount that I would pay if I were just paying my portion of my husband's insurance. It also would have been really awkward to ask my employer, like, how much is COBRA? I'm thinking of leaving my job, but I'm not leaving yet. I need to see how much COBRA would be. That would be an awkward conversation to have.
Neither Nicole nor Erica were eligible to receive a premium tax credit for a plan from the marketplace. Nicole decided that going on her husband's plan was the best financial option for them, but it was still expensive, and it was difficult to estimate how much she would end up paying in the end.
I think I guessed at what my husband's potential insurance would be from past forms he might have gotten, because we didn't know for sure how much anything cost until we paid it, basically.
Erica also considered the option of going on her husband's plan.
It was so expensive for a family plan, and it's just the two of us, that it was more economical for him to go on the insurance and for me to figure out another option. When I first was looking at health insurance, I didn't even consider or didn't even think of the option of having separate health coverage.
Erica considered plans with direct primary care providers. These are essentially membership plans where patients pay a flat fee directly to a healthcare provider and have no out-of-pocket costs at time of service. These plans are not health insurance. Instead, it's paying upfront for a membership to access primary care services throughout the year. The downside of this option is that it doesn't typically cover emergency services. Many direct primary care providers recommend people who go this route also get a high deductible insurance policy to cover emergencies.
That made me nervous because I just don't know. The only things that I could find that actually covered emergency rooms were the health cost sharing option and the marketplace.
Erica ultimately decided to go with a cost-sharing plan. Cost-sharing organizations, which are also called healthcare sharing ministries, are not insurance companies. This means they don't have to follow the minimum coverage requirements that the Affordable Care Act outlines. Sharing ministries are typically a group of people who may share a religion, who pool funds and agree to pay for one another's healthcare costs under certain conditions.
They can exclude your pre-existing condition. They can charge you more just because they don't like the looks of you, or based on your age, or based on your health, or based on whatever. There are no rules. Often, if they're cheaper, it's because you're not getting the same protection.
I am fairly healthy, so I feel like this is an okay thing for me to take a chance on.
There are a lot of considerations to make when choosing a health insurance plan.
When you think about affordability, think not just about the premium, but about the additional cost you're going to pay out of pocket when you need care. You almost never get 100% coverage. So if you are healthy and you don't use a lot of care, you may find the marketplace is way more affordable than what you're used to at work because right, it's on a sliding scale. If you're older, if you have significant health conditions, you need to count more than just the premium.
I feel like in America, we're in such like a rushing, urgent society. And I feel like with anything, any decision that you're making, any big change that you're making, allow yourself the time and the grace and the space to really sit with it in order to feel comfortable with it. Don't feel like, oh my gosh, I'm going to leave my job, give the resignation for 2 weeks and not have a plan in place. Like give yourself time to like research your options, figure out what's best for you, and don't feel like you have to rush.